Welcome back to the Lightning Strike with Mohammed Fahim.
Good morning, folks, and welcome back to the Lightning Strike. Joining us on the air today is Dr. Azhar Quader. He is the co-founder of the Compassionate Care Network and a retired surgeon. Good morning, Dr. Quader. Welcome to WCPT.
Good morning, Fahim, and it's good to talk to you. Good to hear from you.
Well, thank you so much for calling in. So the other day we were talking about the health care, or rather the sick care in our country, the way that you put it. And I was very intrigued, wanted to know a little bit more about what were your thoughts on that? Why are you calling it sick care instead of health care?
Well, we've been for a long time talking about this issue that we are basically treating patients down the line after they become diagnosed, but we have not bothered to look at the upstream situation with reference to preventing the diseases that we're dealing with.
Okay.
Well, I think the budget that we are spending is about $4 trillion on healthcare, and very tiny, minuscule amount of that is spent on preventive care. So there's a need for us to focus on preventive care.
Okay, and especially I think you were talking to me the other day with regards to diabetes and the continuous glucose monitoring systems that are out there, which can be so critical in saving money down the road for our systems as a whole. So can you talk a little bit about that, and what are the contingencies that the insurance companies are saying, no, we're not going to allow this, when they should be allowing it? So what was that?
Yeah, no, I think this is again political for him. As you know, as healthcare is such a political football, and everybody plays with it according to their preferences. And every year there is a big debate on all of these issues that are healthcare related, but nothing really seems to get done.
Okay.
The issue with the diabetes has been that they did not want to have anything to do with the promotion of the prevention side till the Interest Reduction Act came into the picture, and at that time I think Biden was able to get it passed because of other contingencies that were in this Inflation Reduction Act that they wanted to get through. So what they have done now is they have allowed the cap on the expenses for insulin coverages to be at $35 per month for patients that are insulin dependent and they are U.S. citizens and enrolled in the Medicare program.
Okay.
So that used to be a big fight also, because I think the cost was over a couple $100 every month for a lot of patients, and it was becoming an issue for the seniors who were on fixed budgets and that kind of stuff. So finally, I think they were able to bring that down to $35 a person per month for the diabetes insulin-dependent patients. But the other patients are still left out. And there are about 90 million people in the country who are pre-diabetic. There are about 37 million who are diabetic. Out of the 37 million, about 27 million know that they are diabetic, and about another 7-8 million don't even know that they have diabetes.
Wow.
And so there is a huge problem with reference to the incidence and the prevalence of diabetes. It is one of the chronic medical conditions that drives the cost of health care in the country. The other ones, of course, are coronary artery disease and obesity and blood pressure. Those are the chronic medical conditions that if we were to lump them all together with diabetes, they will account for about 80% of the budget that we are spending on health care.
Okay.
That, as I said again, used to be $3 trillion not too long back, and has jumped up to $4 trillion. And the pandemic showed the evidence of the fallacy that we have in taking care of the healthcare needs of our people without being on a flat universal basis for everybody. There are about 20 million people that are still uninsured in the country, and they don't have any access to affordable health care. And so they were the people that showed up as a result of the disparities in the healthcare system that we have that showed up at the pandemic. We had a disproportionate number of people who were in the African American community, who were also in the Hispanic community, who were suffering as a result of the pandemic, and who were in the mortality figures that were the highest. So therefore, I think we were talking the other day that there is a need for us to use the preventive side of the equation much more so that we can get to the bottom of this problem in a way that would make better sense. At this time, we are not really doing that. So the CGM is a continuous glucose monitoring tool that is now available for people to identify what they're doing in terms of the diet that they're consuming and the results that they're having in their levels of the blood sugar. Not everybody responds to the same diet the same way. The biology of every individual is different. And so when you consume a particular item of food that you are able to tolerate much better with the blood sugar remaining low, another person will not be able to replicate the same results. And these results are always a questionable kind of a number that we can't find out unless we do a finger prick exam of the blood sugar.
Okay.
And that was a huge inconvenience. And the continuous glucose monitor comes into the picture, and what it does is there is a sensor that you apply to your arm, and that sensor then gives you a continuous level of your blood sugar throughout the 24 hours that you are watching over it. And that, I think, is a game changer in terms of knowing what you're eating and what it is doing to your system, and in terms of the results in the blood sugar, you can see for yourself what's happening.
Okay,
That's
so if I go to my primary care physician and I ask him to prescribe this, because I think it's by prescription only, I can't just go and buy that continuous glucose monitoring system myself, can I?
No, you can't. You have to go through a licensed physician, and it can be a primary care doctor or anybody else who has to prescribe that. The prescription is not really a problem. I think it is the issue with the coverage on the other side with the insurances. So the pharmacies will fill it if you have a licensed physician requesting that to be filled up.
Okay.
But then there are the costs involved. And the normal cost of these would run about $300 for the month. And if you are on Medicare and you are insulin dependent and requiring insulin, then it's all available for free. So then this is why I think it is important for people who are diabetic and on insulin and are on Medicare to know about this program and make sure that they are asking for it and then getting the benefit from it.
Wonderful. Thank you so much, Dr. Quader, for joining us. And before you go, I would like you to please say a couple of words about the Compassionate Care Network and what is this group and what do you guys do with that?
Thank you. Yes, we have been doing this work for about 20 years or more now. And this is a non-profit 501c3 organization that has a few goals in mind. From the beginning, it has been access to affordable health care. That has been our passion, and we have always said that access to health care should be a universal right and it should not be a privilege in America. Number two, we have said that health screenings are important to identify people at risk of health risk, and this can be only accomplished if we are offering it in communities on a free basis. And this has been for diabetes, for blood pressure, for heart disease, and for dental health, and for weight management, that we have been promoting this on a weekly basis. Our team has included people that are physicians and nurses and medical students who have come into the picture to do the volunteer work and do this on a weekly basis at different locations in the community.
Wonderful. Thank you so much.
I think we do webinars. webinars are one more thing I would add, if you will allow me to.
Okay.
We do webinars for education, and this is for health education in terms of the same thing that we're talking about now with you, that the community can benefit from on diabetes management and weight management.
Wonderful. Thank you so much, Dr. Quader, for joining us. Folks, the website for the Compassionate Care Network is ccnamerica.com, CCN for Compassionate Care Network, America.com. Please go ahead and visit and get involved and take advantage of these services that are being provided by this great team that is out there. And we'll be right back after a quick break with Michelle Alfano and an update on what's happening with Eric's case. You're tuned in to The Lightning Strike. I'm your host, Muhammad Fahim. With me in the studios today, again, Ken DeLuke and John Arena.